Hey everybody, it's Caitlin. Welcome back to CoronaChat. Today is Monday, April 13th, and we're going to talk a little bit today about sex differences in rates of death due to COVID-19 or the illness caused by coronavirus. And specifically, I wanted to talk a little bit today about why it is that men seem to be getting so much sicker and dying at rates that are much higher than what we're seeing for women. And before we get started, I just want to note that we don't currently have data available that speaks to how the virus is affecting trans and gender non-binary folks, mostly because the data is being reported as kind of disaggregated through binary sex disaggregation, so male, female. But this is a really important question and one that we should keep coming back to about what does this virus mean specifically for trans and non-binary folks, especially those who are on hormone therapy. So I'm going to kind of put a pin in that for now, but I'm going to keep coming back to it throughout this video. So, mortality data from all countries is showing that while men and women both seem to be getting sick with COVID-19, men just seem to be having worse outcomes and seem more likely to die. And there's lots of different hypotheses about why this might be the case. And we don't have a clear, definitive answer right now, but we can start to look a little bit at some of these hypotheses and some of the data, right? So, one hypothesis that was circulating, especially at the beginning of the pandemic, was around differences in rates of smoking, saying that, maybe it is that men are more likely to smoke than women, particularly in China. This is true. And so we thought that some of the differences in rates of death were due to the fact that men were just, more likely to smoke and more likely to be heavy smokers. But as the epidemic has continued to play out, and we've seen a lot of mortality among folks who are not necessarily smokers, we've started to call into question this hypothesis a little bit. And another hypothesis that was circulating was around hand washing. And some people said, well, maybe men are just, less good about washing their hands than women are, and that's why they're getting sick. But if that were the case, we should see really big differences in rates of getting infected, as opposed to, kind of equal rates of getting infected and some people getting sicker than others. So, the hand washing is still kind of floating out there as maybe a piece of the puzzle, but we don't really think that that's necessarily the case. So we've been trying to understand what else is at play. And it looks like there may be some biological factors at work here as well. And so one of these potential explanations has to do with the surface of the lungs. And, men and women have somewhat different proteins on the surface of their lung cells. Remember, our cells, you can think about it as like a little sphere, and it's got all these little proteins sticking out around the outside of it. And these proteins help our cells to interact with other cells, and you can almost think about them as functioning kind of like locks, right? And so if there's a specific key that fits into that lock, right, another protein that matches with that protein, you can open the door to the cell and enter, right? And so we have lots of different kinds of these locks on the surface of our cells, and viruses develop special proteins that are, like the keys that fit into these locks, and that's how they gain access to our cells. And men just happen to have more of the locks that match up with the coronavirus's keys than women do, which might mean that, it's more likely that the cells that are in their lungs, that lots of those cells get infected more quickly than would be the case for women, because the virus has to go and try lots of doors before it's able to get in. But some data on how the virus is attacking cells in petri dishes suggests this might not be as clear and direct of an explanation as we thought it was. So this might be part of the explanation, but maybe not the whole explanation. Now, something else to keep in mind that's kind of interesting is that across many, many illnesses, not just COVID-19, men tend to fare worse than women. Women tend to have better immune regulation than men. And that means that women's immune systems tend to do a better job of kind of ramping up when they need to and ramping back down when they don't need to be at full speed. So it's possible that some of this difference in reaction might be about how the immune system is responding. And remember, one of the hypotheses that's currently circulating about why young, otherwise healthy people are dying is about what's called a cytokine storm. And this is basically when the immune system goes into hyperdrive. And its response to the virus is so intense that it's actually the immune system that ends up killing the person. And so we don't yet know for sure that what's happening with these otherwise healthy people is truly a cytokine storm, but many doctors are saying that what they see looks very much like a cytokine storm. And if it is, it's possible that this immune regulatory piece may explain part of the puzzle, right? So if men's immune systems are less well regulated than women's, then it's possible they may be having more cytokine storms and thus dying more often. Now, it's not quite clear whether these differences in immune regulation are due to genetic components, right? Because lots of the genes involved in immune regulation are on the X chromosome. Women have 2 of those, men only have 1, so maybe that's driving some of the differences. But it may also be hormonal differences, right? Because men and women tend to have different hormones. But we know that these differences exist. And, again, this is one of those places where it's really hard to know what this means for trans and gender non-binary folks, right? Because, whether this is about kind of gene expression, whether this is about, gene expression that's regulated by hormones versus by kind of what's on chromosomes, because we're not really sure how exactly this works. It's hard to know how this applies to gender and gender non-binary folks and trans folks. But this is kind of one of these hypotheses that's out there kind of floating around. Now, it's also possible, of course, that the truth is some combination of all of these factors together, right? Also combined with things like who's more likely to be out and about, who's more likely to be an essential worker, and who may have other underlying conditions that make it more likely that they'll get ill. And other factors like that affect, how likely it is you'll be exposed and then to get sick. And these factors can change from country to country and from community to community, right? So we might be more likely to see that essential workers and caregivers are women in some countries, but they're more likely to be men in other countries. So we may start to see some differences there around some of these kind of more, these factors that have more to do with employment or things like that, right? So while this isn't as definitive of an answer as many of us would probably like, hopefully it helps to make all of this a little bit clearer and give you some information to understand, what's going on with some of these differences. And your good news for today is that New York City seems to be flattening the curve. We're seeing the number of hospitalizations be flat for the 3rd day in a row. And San Francisco is providing a really amazing model of how aggressive containment works and how it's so effective. Even though San Francisco is a similar sized city to Washington, D.C., Detroit, other places where we're seeing big coronavirus outbreaks. The fact that the mayor acted really aggressively and kind of did stay at home earlier than anybody else meant that as of April 10th, they only had 857 confirmed cases of coronavirus and just 13 recorded deaths. So some of this, might be a little bit of an undercount if there's issues with testing, but the fact that they're not seeing hospitals overwhelmed, they're not seeing, these kind of situations where there are tons and tons of coronavirus patients in the hospitals the same way that we're seeing in other cities, shows us that all of this stay-at-home stuff works. So continue to stay at home if you're able, and I'll see you back here tomorrow. In the meantime, stay safe and take care of each other.